Hello, thank you for joining us on this session of tobacco sensation session, physiological effects of tobacco use from Argus Catch program. Next slide. My name is Yaminah and I'm a health educator. Today we're going to be talking about the contents of tobacco sensation in the seminar. What is physiological? Describing the effects of tobacco use on the body, providing information on the different rates of health effects that can be contributed from the use of tobacco. We're going to be demonstrating the prevalence of tobacco use within the United States and specifically New York. And we're going to be describing the health effects of tobacco use on different demographics, such as sex, education, people of color, youth, mental health, and substance use issues. And the final slide, we will be discussing the next topic of our next session. Next slide, please. So, first one is an overview of what is physiological effects, the health effects, what are the effects caused by smoking tobacco, the prevalence rates of health effects that can be contributed to use of tobacco, and population health, the health effects of tobacco use on different demographics. Next slide, please. What is physiological? So physiological is relating to the branch of biology that deals with the normal functions of living organisms and their parts. For smoking, it affects the circulation of blood, the heart, the brain, the lungs, the stomach, the skin and bones, mouth and throat, and reproduction and fertility. Next slide, please. So the reason for this session, tobacco sensation, is to bring awareness of the health effects of tobacco products and explain the different physiological effects of tobacco use. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, chronic obstructive pulmonary disease, COPD, which includes emphysema and chronic bronchitis. Smoking also increases the risk for tuberculosis, certain eye diseases, and problems of the immune system, including rheumatoid arthritis. Next slide, please. Cigarette smoking is the chief single avoidable cause of death in our society and the most important public health issue of our time. Next slide. Health effects of tobacco use. Smoking leads to diseases and disability and harms nearly every organ of the body. More than 6 million Americans are living with a disease caused by smoking. For every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. Next slide. In this image, we can see the effects of certain chronic diseases, and the arrow shows to which organ: stroke, blindness, cataracts, age-related degeneration, congenital defects, pneumonia, diabetes, rheumatoid arthritis, immune function. You can see different organs that it affects: the larynx, the esophagus, the stomach, pancreas, cervix, bladder, and so on. Next slide. What are the health effects caused by smoking tobacco? Next slide. The circulation. So when you smoke, the poisons from the tar in your cigarettes enter your blood. These poisons in your blood then make your blood thicker and increase chances of clot formation, can increase your blood pressure and heart rate, making your heart work harder than normal, narrow your arteries, reducing the amount of oxygen, rich blood circulating to your organs. Together, these changes to your body when you smoke increases the chance of your arteries narrowing and clots forming, which can cause a heart attack or stroke. Next slide. The heart. Smoking damages your heart and your blood circulation, increasing the risk of conditions such as coronary heart disease, heart attack, stroke, peripheral vascular disease, damaged blood vessels, and cerebral vascular disease, damaged arteries that supply blood to your brain. Carbon monoxide from the stroke and nicotine both put a strain on the heart, making it work faster. They also increase your risk of blood clots, other chemicals in cigarettes. Smoke damage the lining of your coronary arteries, leading to furring of the arteries. Next slide. Continue with the heart. Smokers have a greater risk for disease that affects the heart and blood vessels. Cardiovascular disease. Smoking causes stroke and coronary heart disease, which are among the leading causes of death in the United States. Even people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular disease. Smoking damages blood vessels and can make them thicken and grow narrower. This makes your heart beat faster and your blood pressure go up. Clots can also form. A stroke occurs when a clot blocks the flow to the part of your brain. A blood vessel in or around your brain bursts. Blockages caused by smoking and also reduce blood flow to your legs and skin. Next slide. The brain. Nicotine also stimulates the pressure center of the brain, mimicking dopamine. So your brain starts to associate nicotine use with feeling good. According to the National Institute of Health, the nicotine in cigarettes changes your brain, which leads to withdrawal symptoms when you try to quit. When this happens, you may experience a variety of side effects, including anxiety, irritability, and a strong craving for nicotine. Next slide. The lungs. Smoking can cause lung disease by damaging your airways and the small air sacs, alveoli, found in your lungs. Lung disease caused by smoking includes COPD, which includes emphysema and chronic bronchitis. Cigarette smoking causes most cases of lung cancer. If you have asthma, tobacco smoke can trigger an attack or make an attack worse. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. Next slide. The stomach. Smokers have an increased chance of getting stomach cancers or ulcers. Smoking can weaken the muscle that controls the lower end of your gullet, esophagus, and allow acid from the stomach to travel in the wrong direction back up your gullet, and a process known as reflux. Smoking is a significant risk factor for developing kidney cancer, and the more you smoke, the greater the risk. For example, research has shown that if you regularly smoke 10 cigarettes a day, you are 1.5 times more likely to develop kidney cancer compared with a non-smoker. This is increased to twice as likely if you smoke 20 or more cigarettes a day. Next slide, please. The mouth and throat. Smoking causes unattractive problems such as bad breath and stained teeth, and can also cause gum disease, damage your sense of taste, and can lead to oral thrush. The most serious damage smoking causes in your mouth and throat is an increased risk of cancer in your lips, tongue, throat, voice box, and gullet. More than 93% of oral pharyngeal cancers cancer in part of the throat are caused by smoking. Next slide. The skin and bones. Smoking reduces the amount of oxygen that you get to your skin. This means that if you smoke, your skin ages more quickly and looks gray and dull. The toxins in your body also cause cellulite. Smoking prematurely ages your skin by between 10 and 20 years and makes it 3 times more likely you'll get facial wrinkling, particularly around the eyes and mouth. Smoking even gives you a shallow yellow-gray complexion and hollow cheeks, which can cause you to look gaunt. Smoking can cause your bones to become weak and brittle. Women need to be especially careful as they are more likely to suffer from brittle bones, osteoporosis, than non-smokers. Next slide. Reproduction and fertility. Smoking can make it harder for women to become pregnant. It can also affect our baby's health before and after. Smoking increases the risk for preterm early delivery, stillbirth, death of baby before birth, low birth weight, sudden infant death syndrome, known as SIDS or crib death, ectopic pregnancy, oral facial clefts in infants. Smoking can also affect men's sperm, which can reduce fertility and also increase risk for birth defects and miscarriages. Next slide. Here is a short video on the effects of smoking on your body. If you're more interested in seeing this video again, we will have a link for you on our page. Next slide, please. 2, the rates of health effects that can be contributed to the use of tobacco. Next slide. The current tobacco use in 4 major U.S. geographic regions. We have the Midwest, South, Northeast, and West. Blue indicates cigarettes. Orange indicates smokeless tobacco, and gray indicates cigars. So within the Midwest and the South are the highest with 22.2 and 22.7, which engage in cigarette smoking. For the second slide, the current tobacco use by county population types is the same: blue for cigarettes, orange for smokeless tobacco, gray for cigars. We have the larger metropolitan, the smaller metropolitan, urban, and rural. And here it shows that the highest is 28.5 and 25.1 for the use of cigarettes in urban and rural areas. Next slide. U.S. deaths attributed to smoking annually. For lung cancer, 130,659 deaths contributed to lung cancer. COPD, around 100,000. Coronary heart disease, around 99,000. Other cancers, 36,000. Other heart diseases, 25,000. Stroke, around 15,000. Other vascular diseases, around 11,000. Other diagnosis, around 61,000. About 480,000 deaths, U.S. deaths attribute each year to cigarette smoking. Next slide. Tobacco-related cancers in New York State. In this image, we have the rate per 100,000 person and the year. The light blue is oral cavity and pharynx cancer. Liver is yellow. Cervix is dark blue. Esophagus is pink. Pancreas is a baby blue. Kidney and renal pelvis cancers is a red. Stomach cancer is a gray. The larynx is a green, and acute mild leukemia is a dark grayish blue. And we can see here that the largest, in 2015, the highest amount of rates 100,000 per person individual is kidney and renal pelvis cancer. In 2015, the second would be oral cavity and pharynx. The third will be the pancreas. Next slide, please. So despite warning labels, smoking is still very prevalent in most countries. They are still, I know in the US, we do not see as much smoking advertisement on TV, but we do see on billboards, on signs, text messages. In certain areas, you'll see the small billboards on grocery stores, corner stores, bodegas, especially in New York City. You will see the promotion of cigarettes through little billboards amongst urban areas. Next slide. The death rate of smoking globally. The death rate from smoking in 2017, the annual number of deaths attributed to smoking per 100,000 people. And you can see in this map that we start with no data at gray. From 0 to 50 is a light yellow, like a peach. From 50 to 100 is a little darker orange. And from 100 to 200 is a darker orange mixed with red. And you can see that the United States is about 75,000 per 100, 75 per 100,000 people. And you can tell in around Russia area, the dark orange is 100 per 100,000 people. Global burden of disease for the death rate of smoking globally. Next slide, please. 3, health effects of tobacco use on different demographics. And we will be talking about this more in regards to specific population with our additional sessions that we will be posting on here, as well as on our Tuesday sessions at 2 p.m. and 6 p.m. where we will talk more about different demographics. Next slide. Did you know this? Cigarette smoking is down, but about 34 million American adults still smoke. Cigarette smoking remains high among certain groups. Men, adults aged 25 to 64 years old, individuals with lower education, individuals below poverty level. In the Midwest and South of the United States, individuals who are uninsured or unmedicated, disabled, serious psychological distress, individuals with mental health issues, and American Indians, Alaska Natives, and multiracial individuals. Lesbians and the LGBT community are among high rates of cigarette smoking. Strategies essential to continue to reduce cigarette smoking is implementing smoke-free laws, run mass media campaigns, raise tobacco prices, make quit help easy to access. And we will be sharing the New York City help quit line towards the end of this video and on our site. And additionally, within our next sessions, you can get that information there. You can Google New York City.gov, New York quits, / New York quits, New York City quits. Next slide. Among adults aged 18 and over, age-adjusted rates of current cigarette smokers were 30.5% higher among men than women in 2017. So women smoke less than men, but it's still at a high rate. Men at 16.0%, women at 12.3%. Next slide. By age, current cigarette smoking was highest among people aged 25 to 44 years old and 45 to 64 years old. Current cigarette smoking was lowest among people aged 18 to 24 years old. Nearly 8 of every 100 adults aged 18 to 24 was at 7.8%. From 17 out of every 100 adults aged 25 to 44, 16.5%. About 16 of every 100 adults aged 45 to 64, 16.3%. And about 8 of every 100 aged 65 years or older adult is 8.4%. Next slide. By race and ethnicity, current cigarette smoking was highest among non-Hispanic American Indians and Alaska Natives and people of multiple races, and lowest among non-Hispanic Asians. Nearly 23 of every 100 of non-Hispanic American Indian Alaska Natives was 22.6%. About 19 of every 100 non-Hispanic multiple races individuals, 19.1%. Nearly 15 of every 100 non-Hispanic Blacks, 14.6%. 15 of every 100 non-Hispanic whites, 15%. Nearly 10 of every 100 Hispanics, 9.8%. About 7 of every 100 non-Hispanic Asians, 7.1%. Next slide, please. By education, current cigarette smoking was highest among people with a general education development, GED certificate, and lowest among those with a graduate degree. 36 of every 100 adults with a GED certificate is 36.0%. Nearly 20 of every 100 adults with a high school diploma is at 19.7. Individuals with some college and no degree, 18.3. Individuals with an associate degree, 14.8%. Individuals with an undergraduate degree, 7.1%. And adult individuals with a graduate degree, 13.7%. Next slide. By household income, current cigarette smoking was higher among people with low annual household income than those with higher annual incomes. About 21 of every 100 adults with an annual household income less than $35,000 was at 21.3%. An income household of $35,000 to 70, we're going to round it about to 75,000, 14.9%. Nearly 15 of every 100 adults with annual household income of 75 to 100,000 is 13.3%. And household income greater than 100,000 at 7.3%. You can see the difference there in numbers in regards to household income, 21.3% at individuals less than 35,000. It's a great number. Next slide, please. By limitation, adults with limitation or disabilities were more likely to be current smokers than those without. About 19 of every 100 adults with disability or limitation, and about 13 of every 100 adults without a disability or limitation. Next slide. Behavioral health includes individuals at risk or suffering from mental, behavior, and/or addictive disorder. They are a special population in tobacco use research because of their higher smoking prevalence than the general population of smokers, disproportionate tobacco-related health disparities, lack of access to treatment, underrepresentation in prospective longitudinal treatment trials. This statement shows that individuals who have a behavioral health or mental health disorder, along with addictive disorder like substance use, do have higher smoking prevalences. And this can be attributed to why smoking is also treated in substance use populations. Next slide. Tobacco disproportionately impacts substance use populations. Smoking rates are estimated to be as high as 74% to 88% among individuals with substance abuse problems. Estimate ranges between 85 to 98% for individuals in a methadone maintenance program. Individuals who abuse substances tend to start smoking at a younger age, are more likely to be heavy smokers, are more nicotine dependent, experience greater difficulty when quitting. Next slide, please. Tobacco disproportionately impacts mental health populations. Tobacco use among persons with mental illness is 2 to 4 times as great as among the general U.S. population. In general, the more severe the psychiatric condition, the higher the smoking prevalence. Next slide. This is a fact from the CDC. Tobacco use is the leading cause of preventable death in the United States. Here is a number that you can call, 1-800-QUIT-NOW, and this is universal for United States. Next slide. The overview that we talked about. What are the different types of health diseases that can be contributed from the use of tobacco? Do you know that the prevalence of tobacco in New York? Can you describe the rate of tobacco use on different demographics? Much of this is a discussion that we talked about today. These are some things that you can read and go over and take in mind and do your own research if you would like to. Educate yourself in regards to the rates of tobacco among different populations and different counties, cities, areas within the United States, and the types of tobacco that's being smoked, whether it's menthol, non-mentholated, or smokeless, or cigarette. These are good researches for individuals who are thinking of quitting, thinking of doing the research to start quitting, or may need help, may need some information, or unaware of the health effects of tobacco use among your organs, your body, and how it affects you, how smoking and how much smoking it affects individual on a daily basis. Next slide. Next session, we will be introducing tobacco cessation products. And we have a weekly webinar Tuesday at 2 p.m. and 6 p.m. and we talk about these issues. And you can join us. The link will be on our YouTube page that shows our videos if you would like to join a live webinar. Next slide. Thank you. Here is our contact information. You can give us a call, you can email us, you can catch us on Facebook, Instagram, and Twitter. Have a great day.